All right, it's good to see you all. Thanks so much for joining, and I'm going to go ahead and start us some slides. So, if you're just joining us, welcome. My name is Cassandra Reisick. I am Policy Director at NC Child, and my favorite summer activity is reading a book outside. Just give me that sunshine, give me that warm weather, and give me a good book. So, good to see you all. Thanks so much. So, I'm going to go ahead and start our slides.
Isn't that straight from Green Acres?
Pardon me?
Isn't that straight from Green Acres?
It might
Green
be on the
Acres
same wavelength. All right. And a reminder for any folks who are joining, if your name says Hannah Preston, just go ahead and rename yourself. We had a little glitch on our Zoom end. So thanks so much for being here. All right. And let me get y'all to see my slides. Right. All right, y'all. Make sure y'all can see my screen. Still see it? Not yet. Okay. Love a good little bit of tech drama on a Monday. I'm just going to go ahead and show them from their shortened side. Okay. Let me make this a little bit bigger for everybody. All right, y'all. So part of our warm up was just go ahead and show your name, your title, and organization, and your favorite summer activity in the chat. So let's go ahead and get started. So, one of the things I always like to start with is upcoming events at NC Child. Thanks to everybody who's on this call and the work that you have done to keep um, EarlyWell and the coalition moving forward. So we have some exciting events we want to share from our end. So September 6th is going to be our second annual field day. It is a free event. We are currently working on the promotional materials and save the date. So that should hit your inbox in just a little bit within the next month or two. But this is a free event for all families, community members, anybody who wants to kind of gather. We really think of this as really the state of the child day activity, right? So we're excited just to gather families. It's going to be a free, fun event. It will be hosted in partnership with Laurel Parks and Raleigh City Parks. So just keep that on your calendar, September 6th. Please hold that date. And then additionally, I want to share November 3rd is going to be our annual EarlyWell convening. It's going to be in Raleigh this year. And so look, that is going to be coming out in our newsletter next week. But just want y'all to have that kind of early access. Just know that that date is going to be happening. And we would love to see each and every one of you there. And I'm going to kick it over to Stacy Pullen. Are you on? Not sure if she's on yet.
I'm here.
Okay, Stacy, I'm going to stop sharing and I'm going to go ahead and turn it over to you. I know we want to just share some other events. And y'all, I'm so excited to have Stacy on this call and be a part of this conversation. And if there are any events that y'all are hosting, please let us know. We like to uplift them in spaces. So go ahead, Stacy, I'll turn it over to you.
Hello, everyone. I'm the director of Foster Pantry here in southeastern North Carolina. We are based out of Wilmington and have a satellite location in Onslow County. And this is our 9th year of working with the local foster care community. And one of the things that we always run into are social workers and guardians asking for support and resources, or families coming to us asking about support and resources outside of what we can do, aside from the essential items. So for like beds or tutoring or just in general, really anything. So last summer we had two girls that had aged out and they came to us asking.
That's okay.
That had asked about housing. And when they talked to their social worker, their social worker and then the social worker called us and was like, hey, what do you know about housing in the area? And my first thought was, well, this child's on Medicaid. She's eligible for the HOP program. So I asked, well, have you reached out to the HOP program? And this social worker had no idea what the HOP program is. So actually tomorrow, what we're doing, we have invited social workers from the foster care system, from the school system, guardian ad litems, anywhere, anyone welfare realm to come, and we're going to introduce them to a lot of the nonprofit partners that we partner with, that throughout the community, from the Resiliency Task Force to Sleep in Heavenly Peace that provides bunk beds to Smart Start, Child First, anybody that we could think of that we've used, that we've referred our families to, we have invited them to come and speak about what they do, and then allow some networking time for these professionals to ask more questions and get to know them a little bit better. And our friends at NC Child the event, so that's pretty amazing. So yeah, just advocate, helping everyone better advocate for the kids. Obviously, we do offer resource navigation with some of our supports and services, but we also want the social workers to know that there's more out there than just their standard state programming.
Thanks so much for sharing, Stacy. And we are so grateful to be a part of that day. And just as y'all are doing a lot of things across the community, please keep NC Child in mind as when it comes to us being able to be there at a table, sponsor an event, anything like that. We really want to uplift all the work that y'all are doing in this space and in all the spaces. So really grateful to have y'all. Got some other friends currently joining us. All right. And as always, if there is something that you want us to uplift in our newsletter, please let me know. We regularly send those out in partnership with NCECF. So anything that we can do to kind of share resources and share community. Cheryl, I see your hand.
Yes, ma'am. Good morning. I just wanted to follow up on Miss Stacy Pullen's information. Excuse me. The event that you're having for guardian ad litems and foster care workers, is it too late to sign up? And secondly, where is it being held?
It is being held in downtown Wilmington. That's New Hanover County. And if you're interested, I will put my email in the chat, and you can email me, and I can respond back with the information we would need if you wanted to attend. So
Thank
just, I'll send you the agenda and, lunch, dietary restrictions and stuff like that. So I'll stick my email in the chat now, and please feel anyone that is in the area and wants to come, please reach out.
It is tomorrow. Just to let
Yes.
everybody know.
Yeah, it is tomorrow at 8:30 is check-in.
Awesome. Thanks for uplifting that, Cheryl. And thank you, Stacy, for offering that opportunity to attend to anybody who is available and in the area. So I'm going to go ahead and go back to our slides. All right. So one of the things I always want to be able to share when we can on these calls is just some updates from Jones Street. This wasn't on the agenda, but I thought that if I have y'all here, why not get to share a little bit of this? So as many of you know, long session started in January. And since January 25th, we have seen 17 bills that have been filed related to EarlyWell's priorities. Really exciting to see that down on Jones Street, there is excitement, there's interest, there's passion to really be able to be thinking about some of the work that we're doing in this space. And next deadline on our calendar that we always want to share was crossover. So crossover was May 8th. One of the requirements is that all bills that are introduced into one of the chambers has to pass that chamber and be introduced into the other by that deadline. So as of May 8th, last Thursday, we have seen 3 of those 17 bills that have passed. They've passed one of the chambers and they're moving over to the other. As always, if you want to know what some of those additional bills are, I can share them. Some of the bills that we're watching in this space includes, So some of the bills that we're watching in this space include the Family Empowerment Act. Thought that was something. There is also investing in community services in funds for that in Mecklenburg County. And so you can find all of the bills that we are tracking on our legislative tracker on our website. I will drop the link for that in the chat, but wanted to just make sure and uplift some of the exciting things that are happening, the movement that's happening, and, you know, the intentionality and the passion to address child and family health in North Carolina. The last thing that I always like to share in this space is we're coming up on budget deliberations. Some of our folks inside the House and Senate have been just saying they think that things are going to be continuing to move in this space with the budget. Some of our folks down on Jones Street have said the House budget right now, we think is going to be released in the next couple of weeks. This is with some intel from some folks who are down there and have said that the calendar's pretty quiet right now. And if the calendar's pretty quiet, that usually means that they're behind closed doors working on some conversations and things like that. So just stay tuned for that. NC Child will be sure to share an update when that comes out after we evaluate that. And as always, Tiffany Gladney does our weekly legislative updates. So if you're not signed up for that, please let me know. And I can send you the link for that directly. It's a great way to just kind of stay up to date on all the things that we're following, because there are a lot of things that are happening down on Jones Street. So with that, let me go to our next slide. So I wanted to hold some space in this call today for Laurel Powell. She is our Family Support Network representative. She's partnered with us in a lot of different ways related to EarlyWell. And I just wanted to share, I wanted to hold some space for her to be able to share some updates of what Family Support Network is doing, why Family Support Network is kind of talking at this meeting, and kind of answer any questions that y'all might have, some burning questions, some thoughts in that space. So I'm actually going to turn it over to Laurel at this point, and I'm going to be dropping some different resources in the chat. So as we're kind of moving through that, just let me know what else you need. But Laurel, I'm going to turn it over to you.
Thank you. And I saw that Kelsey, I think, put a message in the chat asking for clarity on the 3 priorities that were covered in the budget. Did you see that question?
Yeah, thanks so much for uplifting that. So, and I'll go ahead and respond to that in the chat, Kelsey, and then we can talk offline if need be.
Just a second, let me get my screen set up straight. Okay, are you guys seeing the regular view? Okay, great. So this is sort of an updated version of something that I shared with the community engagement team last, I think it was last maybe July. And so some of you guys may have heard some of this information before, but the numbers and things like that have been updated for this year. So just wanted to tell you guys a little bit about Family Support Network and where we came from, the things that we're doing now, why the work that we're doing was voted on as a priority for EarlyWell, and then what our plan would be for this legislative act. So just to get started, the roots of Family Support Network, we actually began in 1985, so we are celebrating our 40th birthday this year. The network originally began at the UNC School of Medicine, when a pediatrician and a social worker supporting families with premature infants really saw a lack of resources to help families build connections in their communities once they were discharged from the NICU. So the families had infants that were born prematurely or had genetic disorders, children that didn't have diagnoses, but they were at risk for developmental disabilities and chronic illnesses. And those families were really wrapped up well in support at the hospital, but then once they left, they were kind of on their own, and it was very scary and isolating for these families. And so as the doctor and social worker were following up with the families back in the community, they began making connections with former families that they had served or families that they were serving that were living in those communities, and began to build this grassroots network specifically for families to reach out to in their own communities. support. So that started at the School of Medicine, and they really learned quickly that the best way to connect families to their communities was by connecting them to other families like them. So families that understood how to access services, where the specialists are, and sort of maybe most importantly, how it felt to be constantly worried about rare medical conditions and financial stressors and how to relate to other parents when your child is so different from theirs, what it's like to have a child that's so chronically ill. And so they were really implementing a peer support model before peer support was actually a thing. And that turned into the Family Support Network. So it went from a network of parents to a network of family-led agencies. And currently the Family Support Network is a network of just very close-knit agencies run by caregivers of loved ones with developmental disabilities, special healthcare needs, behavioral health challenges. The network is accessed by reaching out to the local affiliate agency in a home community, but you can also access us through a statewide 800 number that we have, and I have that on these slides, and I'll be happy to send these out afterwards, or through our online portals. Excuse me. So there isn't an affiliate living in every single county in North Carolina. We do serve 70 counties directly, and we've actually, this fiscal year, have already directly touched families from 88 of the 100 counties, even though we don't have affiliates directly serving all 88 of those counties. So we can provide over the phone information and referral and virtual workshops to those counties that do not have affiliates directly serving them. Our goal is to obtain funding so that we can have a Family Support Network navigator in every county in North Carolina. So you can see on here these little circles with numbers. This is where our affiliates are located. Obviously, you don't see 70 of those, and that's because they all serve multiple counties. So up here in Watauga, that's our FSN of High Country, and they support 5 or 6 of the counties up here in this area. Down here in Jackson, she supports 7 counties down in this most southwestern region of the state. So, so even though you don't see a little circle in every single county or in 70 counties, you can tell that we are serving multiple counties per affiliate. So talking about these affiliates, so FSN affiliates are made up of different types of agencies. Some are based at hospitals, right in the NICUs, so they're meeting babies and their families literally the day they're born. We currently have a presence across the state in 5 NICUs, and we are in conversations with a couple of more NICUs to get some presence there as well. Some of our affiliates are based in local Smart Start offices and CDSAs to meet children and family as soon as they receive a diagnosis. Some are based in local 501c3 agencies where they have established really long-lasting relationships, and they're connecting with families through other families and word of mouth and targeted outreach. So each affiliate is housed in one of these agencies that you see here, and I put up all of their logos in case those logos are familiar to you in your area. So on some of these slides, you'll see I put some blue quotes in here from families that we have supported over the years. And these quotes are all directly related to parent-to-parent matching, which is one of our core services, which I'll get into in just a minute. But this is the mission of Family Support Network. So we're a really strong network aimed at working together to support families across the state, because we know what it's like, and we're determined to make this journey easier for families. We know what it's like to have children that have lots and lots of evaluations and assessments and services. And we know what it's like to have children that may have more frequent hospital stays, that may be interfacing with mental health services a little bit more frequently. So you'll often hear us talking about caring connections. Everything we do at Family Support Network is rooted in reducing isolation of families and increasing the capacity of caregivers. So one of the ways that we do that is through Caring Connections. We also provide support and education. So this is a list of what we refer to as our core services. So no matter what FSN affiliate you reach out to, you can access these 5 core services. So some of our affiliates also, in addition to these services, offer a lot of other services. But when we're talking family support network services, these are our 5 core services. So we have the parent-to-parent matching, which is a peer-to-peer program where caregivers are matched with other caregivers who are trained volunteers. So all of our parent mentors are volunteers. We rely heavily on volunteer presence in all of our programs. And these peer mentors are matched with parents whose children experience similar diagnoses or who are experiencing similar challenges. We also, every affiliate offers the parent mentor orientation training. So that's an FSN specific training for our parent mentors, and it's offered throughout the year, sometimes in person, sometimes online. We try to make it very accessible for folks across the state and for folks to meet others in their local communities. So we also offer information and referral, and that's really our most basic service. That can be accessed through our FSN network website. You can call our 800 number. You can reach out to a local affiliate. We take calls from parents and caregivers themselves. We also receive lots of phone calls from other support providers in the area. We've received calls from school systems, from doctors, all looking for resources in the area to support families that they're working with that have children with special health care needs, developmental disabilities, or behavioral health challenges. Our next core service workshops that are offered throughout the year. They take many shapes and forms. And with this core service, we include a lot. Included with workshops are our support groups. And those are for support groups specifically for family members, workshops for family members and providers. Our workshops could be Triple P Stepping Stone seminars, which is that evidence-based positive parenting program that's specifically designed for families of children with disabilities. We provide IEP workshops, introductions to services, local support groups, and we have some targeted support groups that we have available in different parts of the state. Some of those are targeting Black parents for support groups that are specifically for Black parents or Black caregivers who have children with special health care needs. We have dads-only support groups to try to increase connections for male figures that are in caregiving roles. We have support groups specifically for the Koala Boundary out in Cherokee to make sure that we're getting information and caring connections to families that are in some of those more historically marginalized areas. And then finally, we have that service system navigation piece, and that is that's really for families who need more than just a phone number or a website that you might get with our information and referral. These are really for families that need more one-to-one support on filling out applications, understanding IEPs and what's going on in IEP meetings, understanding that transition from early intervention to the public school system. So those are all of our 5 core services. This is just an overview of some of the numbers from our work. So our current network-wide funding comes from mainly from a DSS child maltreatment prevention dollars. We also have an annual state appropriations fund that's earmarked at UNC for family support network services. And so with those dollars, these are the numbers that we are receiving at this time. So we have done these numbers came from our 3rd quarter report. So this was up until March of 2025. So between July 1st of 2024 and March 30th of 2025, we had provided 2,659 information and referrals. We had provided 72 trainings or workshops, and we had 410 parents attend those. We had provided 71 parent matching through our parent matching program, which is where we utilize those parent mentors. 28 different events across the state for social activities for families to get to know one another and build community. 679 families received one-to-one support across the state from one of their FSN affiliates. Those support groups, including SIB shops, which are play-based support groups for siblings of children with developmental disabilities. We've had 164 total support groups serving 1,300 family members. And then we have collaborated with 1,700 different times with different agencies out in the community. You can also see over in this table here with our training and workshops, these are some of the outcomes that we've received from some of the surveys that we send out from our training and workshops. We really aim those at increasing confidence in parenting, and so 90% of our parents said that attending one of our training or workshop events increased their confidence. 96% of the parents said that they learned new information from the event, and 97% of the parents and caregivers said that they would recommend the training and workshop to others. So here are a few more quotes, and these are pretty long quotes, but I tried to highlight some of the things that they're really talking about, some of the areas that they're really addressing through these quotes. Helping to relieve personal stress, providing an additional support system, focusing on the mental and emotional well-being of the caregiver and the family. These are all things that FSN is doing every day. So we're reducing the strain on the mental health services for caregivers. So caregivers, we know, are at a really high risk for need of mental health services for themselves, just due to the high incidences of depression and anxiety that come from being a constant caregiver. And so by having some of this capacity built through one-to-one peer support through our parent matching program, as well as those support groups and building capacity through education and workshops, we're reducing that strain on the mental health services that we know are already under so much strain in our community. And improving access to and understanding of behavioral health services. There are lots and lots of ways to get into behavioral health services for families, and by having people that have walked in those shoes and have accessed those services in the past, it's vital that parents can get clear insight on accessing and limiting the amount of time that it takes for them to navigate through that system. And then decreasing caregiver isolation. Again, we know that our caregivers have lots and lots of isolation, particularly for families that have very young children who they're navigating diagnoses for. So our work really focuses on just giving parents access to knowledge, access to resources, and access to connection. So the policy ask for FSN through EarlyWell is requesting $728,000 in recurring state budget funding to expand the program, which would allow us to have one family support network staff member in each county across North Carolina. So one person that has lived experience that can provide support, caring connections, can provide resources to families. So every county, no matter where you are in North Carolina, would have one person dedicated to providing that information through Family Support Network. Just to show you how we would do that in our phases. So this is a map that we have on our website that shows you the service areas for all of the affiliates. So all of these pretty colors show you, this teal color is the counties that are served through FSN of Central Carolina. And the FSN University office, where Julie Swiggett-Williams and I work, Julie's on the call with us now, serves the triangle area, and so we're all in these orange areas. If you look at these kind of magenta colored counties, these are the counties that we do not currently have affiliates assigned to. So that means that we don't have in-person support groups in these counties. We don't have in-person folks that can go out and meet with families at their counties. I'm sorry, at their homes or at the CDSA. We don't have people directly in those communities. And that is what we are hoping to increase with our ask through the EarlyWell policy priority. So phase one of this policy priority would be that we would roll out some support in these sandhills areas. And the reason that that would be phase one is that we already have some great connections there and would be really easy to roll out putting some paid family support coordinators in these areas to provide these services. So we think that that phase could be done pretty quickly. Phase two would be coming over to this eastern part of the state and getting some of these counties set up with family support coordinators. We do have this big gray area that is served through Family Support Network of Southeastern North Carolina. And then this green network up here, or this green area up here that's served by Family Support Network of Northeastern. And so it's these magenta counties over here that really need support. And if you live in Eastern North Carolina or you've been to Eastern North Carolina, you know that there is a lot of driving involved in this part of the state, right? A lot of land with not always a lot of resources available to families. So we think it's pretty crucial that we have somebody in those areas, that these families that are already marginalized and already experiencing so much isolation and such high need, have somebody that knows their area, that knows their local community, and that knows the services and support systems that are there. And then phase three would focus on getting these 3 counties set up with coordinators. And we made these 3 counties sort of the last phase because they are so hugged so tightly by some of our other organizations that are reaching out over in those areas.
So Laurel, Gregory Jones,
Yes.
excuse me for the interruption, but yeah, so you have a need as you've described in those 3 phases. For anyone interested, is that the point where you'll go over the details of qualifications?
Yeah. So right now, our funding that we have, our current funding, will support these areas. That's what we have the current funding for. So if we were to get increased funding, then yes, that would allow us to have financial partnerships in these areas. Because we don't have that funding right now, we do have partnerships, but we're not able to put a paid family support coordinator in those counties.
Right,
So
right. But again,
they're more informal.
yeah, but if somebody just wanted to volunteer their time, we've got a lot of people either laid off or retiring now. So if you could specify the qualifications that you are looking for, maybe that can be a gap solution until you get the funding that you need. Just putting that out there.
That's a great suggestion. Yes. Yeah. And so our next slide talks about like how can we lean on you guys for some of that support. So spreading some of that information and some of those stories, helping us connect with policymakers. But you know what, Gregory, that also includes helping us connect with families in that area. One way that we are connecting right now is by we have an advisory council for Family Support Network, and we are gathering parent leaders from each of those counties that have children that have special healthcare needs or developmental disabilities or behavioral health challenges that are reporting to us what are the needs in the community so that we can figure out ways that FSN can support some solutions to those needs in those areas, specifically targeting those families. And then considering partnerships with FSN affiliates in your area. And so, yes, I can go into, Gregory, I can put my email in the chat and we could talk a little bit more one-on-one about what we are looking for those coordinators. So yeah, that would be great. So for more information on us, we have a website for our entire network, and on that website there is a page that says local programs where you can go in, you can click on your county, and you can find how to locate or access the FSN in your area. This is our statewide 800 number. Again, that is available for anyone to access for information and referral. So whether it's a family member or someone that wants more information on FSN, or somebody that's looking for a specific resource for families that have children with special healthcare needs, developmental disabilities, behavioral health challenges in their area, we can support that way. And then we also have a Facebook page, Family Support Network of NC, and we often highlight upcoming workshops, training, support groups, things like that that are going on across the state on that Facebook page. So that is the information that I have to share. I'm going to stop sharing right now. I see that a lot of things came up in the chat, and I'm sorry I wasn't able to see those. So I'm not sure, but I'll look real quick and see if that I could answer. Oh, Marion was on the board of the FSN of Central Carolina in the beginning. Thank you, Marion, for bringing that up. Okay, and the status of the ask for the recurring $728,000. We're asking. I think that is the status of it right now. We have not gotten any information that it has moved forward in any bills. So right now it's kind of out there. And I don't know if Cassandra or Kristen have anything that is a more educated answer for that.
Yeah, Laurel, you're spot on with that. I think that especially within this work, for this work, it's continuing to educate, right? Educate our lawmakers, educate those folks in the power decision-making positions, and really sharing the stories of this community. So I think that you really elevated something that I think that this group might be able to support with, right? Like, how can we continue to find those families? How can we share that out? How can we kind of help tell the story of FSN and how important it is? So, continuing to educate. Great question though, Alexandra. I'm so glad you brought that up.
And Alex, you asked about some numbers of families that really are in that EarlyWell range. And I'm just going to pull up our most recent quarterly report, and I can put those numbers in here. And that is an important distinction, because at FSN, we do serve families up to about that transition age. We'll answer the phone for anyone that calls. And if we're not the most appropriate service for them, then we will refer them to another agency and try to do a warm handoff with them. But for EarlyWell's purposes, we do a lot. We're on almost all of our countywide LICCs, the local interagency coordinating councils that works with that preschool population. And we are doing a lot with our Smart Starts, our CDFAs, our pediatricians, getting a lot of referrals for those kids that are transitioning from early intervention into preschool services. So yeah, doing a lot of work with those really young guys. Let's see, how are families made aware of FSN? So a lot of FSN has been through, because we've been around for 40 years, a lot of it has been word of mouth. And we've really been working on trying to change that. So this is asking specifically about a family friend who had a premature baby in one of the large Triangle NICUs. And they had not heard about FSN. That is great to hear, because Julie has just met with one of the, I think the special infant care, critical care unit, Julie, is that what it was, at UNC, to make sure that we have information for them to give to families, and to see if there's a way that we could, potentially be coming in to visit with families and talking with families. And we're working with WakeMed to do the same. So that's the information I've got. If you've got other questions you want to put in the chat, I'm happy to answer what I can. And I will look for those numbers that Alex asked about, and I can put those in the chat now too. Also happy to send out these slides for a more thorough look through for you guys afterwards.
Laurel, this is Marion. I just want to point out one other thing that we'd really like to see go forward with our family support network in North Carolina. Nationally, we've had family support, like family voices and that sort of thing, actually help people in primary care practice by having paid family advisors in practices to help practices understand how to be more family friendly, to respond to what are the particular communities that they're serving and what are the needs there. And we have seen that it has really changed practice in terms of helping people understand, how do we ask these questions? How do we communicate with this community? What are the best things we should do in our practice? I would say that nationally it's been a huge thing. And I'd really like to see us move in that direction. My, family support network was a big part of our ABCD advisory board for 19 years and helped us set policy in North Carolina around developmental screening and social emotional screening and all of that in primary care. So, I mean, I love what FSN does for families and that sort of thing, but they're also very, very excellent at being partners in setting policy. So, anyway, kudos to FSN. But I think I'd love to see us have a vision for FSN to, be really at the forefront in some of this policy work that we're doing.
I love that idea. Thank you. I'm just jotting down some notes.
Any other questions while we have the expert Laurel on the call with us today? Well, go ahead.
Laurel. Oh, hi. Yeah. I was thinking about the kinds of questions that somebody in a legislative body might ask. So I think they probably would ask about the intervention itself and also the outcomes. So are there any evidence-based or promising practice aspects to the interventions or the services that you're providing? And then what kind of outcomes have you been able to demonstrate?
Yeah. So the parent matching program is based on the P2P USA parent matching program that was developed. That is a promising practice. And so we utilize their all of their rules for the process to make sure that we're keeping it fidelity to the model that they have developed. And our outcomes come from surveys that we give to the families. And our surveys are consistently over 90 and sometimes over 95% saying that families have built capacity, that they have increased confidence, decreased isolation because of the parent matching service in particular. And because FSN is a family-led program, that means that across the state, all of our affiliates, a minimum of 75% of our paid staff are folks with that lived experience of being a caregiver of a child with a special healthcare need, a developmental disability, or a behavioral health challenge. And then past that, a minimum of 25% of all of our board of directors and advising board members are folks that have that lived experience as well. And so, so even beyond just the official parent matching service, we are using that lived experience to provide these other services like the information referral and the service system navigation, the one-to-one support. So what we base sort of all of that on, or all of those services have built around that parent matching service. And that's sort of the backbone of what FSN does. And we have over 600 trained parent mentors in the state right now, and they're all volunteers. They're every one of them. None of them are paid. They're all volunteering because of support that they've received through FSN on their journey, or because of the support that they've received from someone, and they understand the value of having that lived experience support. So to me, that sort of speaks volumes about FSN as a whole. So yeah, just want to.
Laurel, thanks for sharing that and, continuing to keep us educated as this moves forward and, how we can continue to support you. So I want to be cognizant of time. We've got about 10 minutes left. And so I just want to kind of hold some space to see if there is anything else around FSN, anything else around our Jones Street update, anything else y'all need from this space, or any other needs that y'all have that you want to uplift in this space that other members of the policy action team can support you with. So just want to hold space for a minute or two for that. Okay. I haven't seen anybody jump off mute, but as always, I'll drop my email in the chat and you are welcome to reach out to me anytime you need. I want to just say thank you to each and every one of you for being here in this space and being a part of this work as we continue to move this work forward. It is hard. So please continue to take care of yourself and take care of your people in your circles as we continue this work. And just want to say once again, thank you. We couldn't do this work without you in our corner, without y'all spearheading this work. So with that in mind, I just want to share that our next policy action team is going to be July 14th. I will send a reminder for that as the policy action teams meet bi-monthly. And Cheryl, I see your hand is raised. Go ahead.
I was just wondering, are we able to receive a copy of this PowerPoint?
Yes, we can absolutely send Laurel will send her copy to me, and then I will upload our slides as well, and then they are all in a Google folder, and so I will make sure that I send that out to everybody on this call today.
Thank you.
Absolutely, thank you.
Cassandra, I saw Mary was posting about if FSN or Reach Out and Read was included in the Senate budget. And I thought, yeah, but it might be nice to hear the status of all three of the policy priorities and where efforts are happening, what the movement is around all three. Is that something that you could share?
I think so. I also, I know Kelsey had asked something very similar above in the chat, so I'd be happy to kind of redrop the three priorities in there. I did mention up above that, we haven't seen either any of the three policy priorities in the Senate budget. Hopeful that maybe that we'll see them in the House appropriations, but happy to share that again for what the three priorities are.
And I guess what's being done to try to get them into that House budget? I'm just getting into the nitty gritty, like what?
Yeah, you know what? And I know we talk a lot about this on the coordinating team as well. So just really what's happening, education, 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 really making sure that our lawmakers know exactly kind of what's happening around this space, how these programs are impactful and powerful, and being able to really kind of share those stories. I could go in and talk about, the impact of FSN, but I don't know that I don't have the direct experiences. And so really we're continuing to make sure we can uplift spaces where those stories are being told to the folks who have the decision-making power. So really making sure that folks down at the GA know what they need to know. We're not only educating them, we're serving as a resource. And so NC Child really has positioned itself to ensure that we exist as that resource to them, and continuing to talk with the House Appropriations chairs, the Senate Appropriations chairs, and making sure that those folks know about these programs, and also working with folks like Laurel to hear about what their strategy is and make sure that their strategy is something that's viable, right? And so Laurel and I just had a call the other day just talking about that, getting into the nitty-gritty about that. So yeah, so know that, everything that Laurel is doing, we're grateful for. Everything that y'all are doing, we are grateful for and really excited to continue to support this work. Thanks, Alexandra. And I have redropped the policy priorities for EarlyWell in the chat. Welcome to kind of go ahead and take a look at that. And then I'm going to check the chat to make sure there's not any other questions that I miss. Perfect. With that, I will give you all 5 minutes back in your day. Thank you so much for being here, for being a part of this conversation. And please, as always, thank you for the work you're doing for children, families in North Carolina. Have a great rest of your day. Bye, y'all.